Good evening. My name is Norm Rothfeld. I want to just approach it a little differently. I didn't want to have this operation. I didn't want to have prostate cancer. I would have had 10 biopsies. I was ready to go to every doctor in the country for someone to tell me, don't do anything. But finally, my wife says, you got to do something here. And I researched the doctors all over the country, really the country. I would have flown anywhere. It didn't matter to me. And I finally looked at the website. And there was something about the way it's structured and with the robotic surgery that I said, I'm going to check this doctor out. And I spoke to some doctors up in New York, and they said, oh, yeah, they heard of Dr. Razdan. He's excellent. So I finally said, well, maybe I'll do something. The thing that really touches me here is that I wanted to wait. And Dr. Razdan and I discussed this. I was going to wait like another year or so because the biopsies came back not terrible. Still a little bit of cancer, only 5%, which I researched, I said, that's nothing. 5% of one core is nothing. I can wait. Lo and behold, I scheduled the operation. And Dr. Razdan came out afterwards, and he said, look, everything was good, the nerves were spared. And then we did the pathology. And I think about 10 days or 2 weeks later, I had a meeting with him and his great staff. And he sits me down. I said, oh, God, he's sitting me down. You know what that means? So he says, you're a very lucky man. He said, what the pathology came back, 20%, I think it was 20% cancer, which really, from what I understand, is a lot. And he said, but the lucky part is all your margins are negative. So he said, you're cancer-free. And I tell you, what I realized was that if you know anyone that has the possibility of the cancer, tell them not to wait. Because the waiting, if you have to weigh it, it's far more dangerous, in my opinion, to wait than to have the operation. The operation was great. I mean, it really is. I never had to wear any kind of pad. The cancer is gone. The erections, it's 4 months, almost 4 months. I've been, in a way, having fun with it. I mean, you could have some fun with this. Let's face it. It doesn't have to be dark. And with your wife or whoever it is, you could try all these things. And I'll tell you one thing. Whatever Dr. Razdan says with a possibility to get the erection, I've been doing. The pills, the pump, the muse, no matter what it is, I'm doing it. Whatever it is. And let me tell you, the muse works for me. I can only speak for me. The muse works. They say Alice works. The pump is great. I mean, once I did it, I committed myself to this. No, I mean, it does. It really works. But Muse is great. Now, Dr. Razdan just increased my dose to 1,000, and I haven't tried it. I haven't tried it yet, but I can't wait. One other thing I just want to mention, that the hospital staff is awesome here. I mean, I was only there I guess most of us are only there overnight, but they were so attentive. I mean, unbelievable. I mean, they didn't leave me alone. I mean, they were courteous, respectful. It looks like they really cared about me as an individual. And I don't think you're going to find that in many hospitals. This definitely you do. The staff, whenever I think I called many, many times to check the catheter, to do this. I was reading too much. And the staff is unbelievable. I mean, they responded to me, come on in, check it out, nothing. So I just wanted to share this with everyone and just tell your friends, get tested and don't wait. Thank you.